Hi, my name's Kim Griffiths. I'm a consultant clinical psychologist, and I work here at Green Parks House, which is the mental health unit linked to the Princess Royal Hospital. I also have some time working with the community mental health teams, which come under various different names. So I'm part inpatient based and part community based. So I'm a qualified clinical psychologist, and the pathway behind that is starting off with a degree. That can be anything. Many do a psychology degree, and if you were to do a psychology degree, that would need to be a BSc, not a BA. That's seen as the preferred because it is a scientific pathway, if you like. But not everyone who goes into clinical psychology will necessarily have a psychology degree. It can come from other related subjects. But primarily the pathway to qualifying is to have had a first degree of some kind, and that normally needs to be 2-1 or above. 2-2s can be accepted, but they need to be understood as to why that grade came. And then the most important part is the bit that comes after the first degree, which is a variety of different work roles. So I was a healthcare assistant for 18 months, used to be called a nursing assistant. I then had 2 research posts in a couple of mental health settings, and then I got an assistant psychology post, which is a bit of kind of what a lot of people are driving at, trying to get, where you learn what psychology involves in applied clinical settings. And that CV building is the critical period, if you like, and that can take anywhere between 2, 5, 6 years. The combination of the first degree and the work experience is what's put together to apply for the doctorate clinical training. It's a doctorate, not a PhD, because it's an applied clinical post. And it's quite an competitive course to get into. The doctorate then takes another 3 years, where you have a combination of academic and placement roles, and then you qualify. I qualified in 2007, so I've been practicing now for 13 years. So people would often be interested in what would help access to the field, what will we need. As I say, a first degree is essential, whether you go into clinical psychology. There's also counselling psychology, which is a very similar kind of profession, both of those being the doctorate programme. So the first degree is important. Work-wise, and what can help with career development is working as I did, a healthcare assistant. That can be in all sorts of settings, not only hospitals, but in care homes, children's homes, all these type of settings. Any kind of care or health supporting role, because that helps us to build our character and our personal resilience in working with people, but our interest in working with people. Many will go and work will maybe start with work experience in nurseries, being able to work educationally with children and infants. The other pathway could be anything kind of academic and research based, collecting data, analysing data. They would be really helpful job roles, and they can often be done volunteer, what we call honorary levels, but also paid employments as well. What a lot of these things do is that they start to help us to understand what it's like to be working with people, managing empathy, working psychologically with people in not necessarily a purely medical way, and the other ways that we can work with service users and their needs. A lot of people might wonder kind of why a career in clinical psychology would be interesting or favourable, and I would say that the work is deeply rewarding, assisting very actively in people's recovery, often on a one-to-one, quite personal, intimate basis, is rewarding and fulfilling work. But also mental health, particularly as a whole, is a progressive field. The role of psychology has grown stronger and stronger over the last 30 to 40 years as a recognition of the vital component that psychologists and our psychological world brings into mental health. So it's a developing and expanding field, and that's personally and intellectually rewarding and also fulfilling, to use the term again. So a typical week for us would involve quite a variety of tasks. We would range from individual therapy, so my week, I do some individual sessions with people, some of them are short-term cases, some are very long-term, people with very complex lives. I run a couple of group therapies for different problems. We have a weekly team meeting where all of the different disciplines across the service get together, the OTs, the nurses, and the psychiatrists and their junior medical doctors. So we're developing kind of a whole team approach and trying to understand people's problems. There's various research projects I'm involved in at any given time, and we publish papers and write chapters, looking to expand the scientific knowledge of the field. And also the dotted around, there's always kind of service development meetings or projects that I'm involved in where services are constantly changing and evolving and creating a kind of active input into shaping how mental health services are delivered to people. So quite a range of subjects, tasks should I say, as well as in my role I supervise all the other psychologists at this end of the service, so there's kind of management but also close clinical supervision roles, how people are managing their work and the emotional impact of it and things like that. The toughest parts of the job are challenges, but they're often probably some of the more interesting bits as well. So certainly over the last 10 years, somewhat showing my age perhaps, but after the last 10 years, the impacts of austerity and governmental cuts and the reduction of the health service has put great pressure on all corners of the service. So being able to adapt and adjust to that to still deliver meaningful and effective services is a constant challenge. Yes, interesting as well, and enables us to be responsive, but that's been a particular difficulty of the last 10 years. The other one specific to the psychology profession is the interface with psychiatry, and that's sort of constantly evolving and, as I said earlier, progressive field, where kind of the leadership and the strength of clinical voice has changed. Sometimes that poses particular challenges, but that's part of working within a developing field.